Chapter 12, Eye. As with previous chapters, in Chapter 12, we're going to look at pronunciation of organs and anatomical structures, and we're going to define and spell word parts related to the eye. And we're also going to look at some terms that are related to disease and disorder. In the graphic of the anatomy of the eye, we have several parts, structures listed here. Some of the more common that we hear about are the optic nerve, of course, and the retina or the pupil, the lens, the cornea. Those are all very commonly we talk about the conjunctiva as well. And we also see that there's some other supporting structures. And of course, we know that the iris is going to give us the actual color designation of the eye. In this graphic, we're seeing looking at another person, what we would be able to see from the outside. So, of course, we have the eyebrow, the eyelid. The pupil is going to be the dark center of the eye. The iris is going to be the color of the eye. We can see, of course, the upper and lower lids. Conjunctiva is going to be the whitish area of the eye. And then the lacrimal caruncle is going to be that little area inside of the eye. In this case, notice this does not have a B like carbuncle. This is caruncle. When we look at the lacrimal apparatus, we're talking about the tear production of the eye. We have the lacrimal gland that is over the eye. Then we have the actual ducts, which are that part that are in the inside of the eye, the canal, the sac, and so forth. And when you look at someone maybe who has tearing from the eye, and we talk about their eyes tear and then their nose runs, then there's a very good reason for that, because as the eye tears, it goes down through the canal, through the sac, and actually ends up through the duct into the nose area. So that's the reason why when someone cries, their nose also runs. In fact, we don't actually have tear production at birth, and newborns don't produce tears. So when they cry, but there's no tears there. And these actually come effective at about somewhere between 4 and 13 weeks. Then they actually are able to produce tears. Some combining terms from the eye. Ophthalmo means eye, and be aware here that a common problem with this term is that there is a tendency to want to leave the H out. And if you pronounce the term ophthalmo, that may help you then in spelling it and getting it correctly. Eyelid is blepharo. Iris is iro or irido. Lens is phaco or phaco with a K or C. Pupil is choro or corneo. Some combining forms that may also be used with eye terms are diplo, which means two or double. Iso is equal. Photo is light. Tono is tension or pressure. And zero is dry or dryness. In prefixes, we have some that we've seen before. A and means the absence of or without. Ben, I believe, is a new one. It means to. Endo means within, and intra also means within. Suffixes, we have to begin with algia, and we've had that one before. That means pain. Malacia is softening. Meter is repeat also. That means instrument used to measure. Plegia is paralysis. And tome means to cut into or incision. Disease and disorder terms that are built from word parts are blepharoptosis, and optosis means drooping, and blepharo means eyelid, so this is drooping of the eyelid. Conjunctivitis is inflammation, is the itis, and conjunctiva is the conjunctiva part. So this is conjunctivus. And phacomalacia, phaco means that lens, and malacia means softening. So this is softening of the lens. Retinoblastoma, oma means tumor, and the retino tells us it's the retina. Blasto is a developing cell, so this is a tumor arising from a developing retinal cell. Xerophthalmia, this is dry eye. Zero is dry, ophthalmo is eye, so this is a condition of dry eye. Example of some terms that are not built from word parts are amblyopia. This is reduced vision in one eye because of misuse or disuse as a result of strabismus. Basically, the eyes are not working evenly. This is also commonly referred to loosely as lazy eye. Hyperopia, this is what we call farsightedness. Macular degeneration is a progressive deterioration of the macula in the retina, and it causes central vision loss or loss of vision in the central part of the eye. If it is age-related quite often, then it is also considered probably the leading cause of blindness in persons who are older. Retinal detachment. In this condition, the retina is separated from the choroid of the eye. Of course, this affects vision, and it's considered a eye emergency in this case. It can be a permanent vision loss if it's not treated quickly. Strabismus. Strabismus is where the eyes look in different directions, and another loose term here used is cross-eyed. And this is where the external eye muscles are not correcting properly, and it may have to be a surgical corrections in this case.